Yesterday, California Governor Gavin Newsom signed legislation making the state's workers eligible for up to 2 weeks of supplemental COVID-19 related paid sick leave. Under the law, employers must provide full-time workers with a week of paid leave to cover a range of pandemic-related needs, including taking care of a sick loved one, watching a child who cannot attend school because of closures or mandated quarantines, and of course, for COVID-19 symptoms. For an extra 40 hours of paid leave, workers must show proof of a positive test.
Meanwhile, new reporting by the Economic Policy Institute shines a light on the unequal toll of the pandemic, and more specifically, the Omicron wave on the working class. Compared to those earning more than $100,000, survey respondents with household incomes less than $25,000 were 3.5 times as likely to miss a week of work due to COVID symptoms over the new year. Low-wage workers are less likely than their wealthier counterparts to be fully vaccinated or boosted, and only 35% have paid sick leave compared to 95% of high-wage earners. Our next guests are here to help break it all down for us. Aaron Sojourner is a labor economist at the University of Minnesota, and Julia Raifman is an assistant professor of health law, policy, and management at the Boston University School of Public Health. Welcome to you both.
Thank you.
Thank you for having us.
And so Julia, on top of the massive disparity in who has sick leave and who doesn't have sick leave, there's also the question of being able to go to work sick. In other words, if you're working around a lot of other people, you have a working class job where you have to leave your house, and you test positive for COVID, you're really not supposed to do that. If you're feeling symptoms, you really don't want to do that. But for a lot of people I knew who worked from home during the Omicron wave say, well, how was it? That was fine. I just worked in bed, and a day and a half later, I was feeling better. So it's not just that they have sick leave, but they didn't even have to stop working.
Yeah, absolutely. We see that the whole pandemic has been characterized by large inequities by income and especially affecting frontline workers with the most exposure to COVID. And our policies can either exacerbate that or reduce that. So paid sick leave is certainly an important policy to help people who do have high exposure to others be able to stay home and still have enough food to eat, enough money to pay rent, enough to support their families. So paid leave, while there's an upfront cost to having people miss work and stay home, it ultimately leaves a benefit for employers and for workers because there are fewer colleagues who get sick, fewer customers who get sick. And so we do see that as an important strategy for not just helping people have enough to get through their illness, but also for ultimately reducing transmission throughout society.
And Aaron, how bold is this new law? Is California really leading the way on this, or how many other states have something like this?
There are a handful of states that have similar paid leave laws. The federal government, during the beginning of the pandemic, we had a pretty universal paid sick leave policy, which made a lot of sense. But then we let that expire. And the reason why we had it was really good. And the reason hasn't really changed. So, the federal government could take action and states should take action. This is not a problem the market can solve by itself. This is something where really public policy is needed because the benefits of the people staying home when they're infectious, it really goes to other people. But the cost of staying home when you're infectious, you bear that yourself. So, there's a real strong public policy rationale for action here.
Yeah, and Julia, I'm sure you're aware of this, the reason that so many managers and bosses are so hostile to this type of policy really comes down to a genuine distrust and borderline contempt for a lot of their workers, where they'll say, if you give them this benefit, they will game it. They'll go out partying the night before, and they'll just call in sick and they'll fake their way through it. So have you tried to kind of study that complaint from bosses? They try to make it a little delicately if they're around their own workers, but really what's underlying it is that contempt and lack of trust.
Yeah, I think that that we have to think about the whole picture of the policy, and so ultimately, this is a very important policy that does better protect not just employees but workers and customers in the context of an unprecedented pandemic, where people are getting quite ill quite often, and it has implications beyond just the employees. I think we see that most people want to go to work. They want to keep their jobs. They want to do their best. But this policy is really important for protecting them when they do get sick with COVID. And I think that we should think of it as one part of a bigger picture. We saw with the Omicron wave that there was not enough supply of rapid tests or of high quality masks, and that it was hard to verify high quality masks. And so while there are upfront costs to the government to scale up production of rapid tests and masks and make them more available to people, ultimately, it's far less costly to provide enough rapid tests and enough high quality masks to people than it is to not provide them and to not be able to protect people from getting sick in the first place, and then have labor shortages and colleagues infecting each other and ultimately making more people sick. I think also with paid leave, we see here that people who earn less than $25,000, less than $35,000, really have the most exposure to the virus and the most missed work due to the virus. And that really suggests it's important to make sure everyone is covered by paid leave policies. People who work part-time, people who are independent contractors often have been left behind by paid leave policies and by unemployment insurance policies and other policies. And I think this is an important moment to recognize how important it is to include everyone in these policies, and that ultimately it benefits everybody in our society.
Aaron, is there any concern that a policy like this, while good for the workers, I guess it puts the burden on the employer, right? And some small employers might have more difficulty covering people's hours, have to hire more people. Maybe they just raise or lower everyone's salaries because they have to pay more people, something like that. This is the state obligating the employer to do something, not actually the state doing something. What about all that?
Yeah, I mean, in theory, that's right. And, I think it is certainly easier for larger employers to smooth over, absences because they have a bigger workforce. But there have been a lot of studies of paid sick leave policies over the recent decades, even pre-pandemic. And it doesn't look like there's much effect on things like wage growth at all. There's not effects on, you hear before surveys of businesses before these policies go into effect are full of the sky is falling predictions. And then after they go into effect, you go back to the same employers and they're like, this is pretty good. We're glad that the public is helping us pay for people to stay home so that our businesses, so our customers and workers can stay healthy. And it shows that you can see reduced infection rates in the community. You can see better income and food nutrition support, like food adequacy for workers. So it does keep the community healthy. There are challenges, but the challenges are there. People are going to get more sick and miss more shifts without the policy. The low-wage workers are the ones who don't have paid sick leave, and they're the ones who are missing work a lot.
And Julia, are there any specific case studies that people who support this policy can point to where it's been implemented and studied and you can draw conclusions from it?
Yeah, so we've looked at what happened when the federal government expanded paid leave at the beginning of the pandemic. And we did see that people who had paid leave were less likely to report food insufficiency. And that helps people stay home when they're contagious so they don't infect colleagues as often, they don't infect customers as often or anybody else. And they don't have to make an impossible choice between having enough food to feed their families or going to work while they're still contagious. So I think it is a really important policy. And just having standards in our country for how we look out for one another and for our society in this pandemic context that makes things harder for everyone if someone does get sick, then it's best for all of us to support them through getting better and avoid infecting coworkers too. And it's part of complementary policies like having enough masks and tests and mask policies during surges that also help protect people.
Well, Aaron and Julia, thank you for joining us. We appreciate it.
Thank you for covering the issues.
Thank you for having us.
And we will have more Rising right after this.